Hello viewers and learners of the Postgraduate Diploma in Environmental and Occupational Health. Welcome to this session, and the course code is MEVE 002 Healthcare, and the topic for this session would be prevention of infections in the healthcare settings. I introduce myself as Dr. Sushmita Bhaska, working in the discipline of Environmental Studies at the School of Interdisciplinary and Transdisciplinary Studies, Indira Gandhi National Open University. So now in the previous lectures, we have seen the different type of infections that a healthcare worker is exposed to. This could be due to the physical hazards, due to the chemical hazards, due to certain biological actions and the agents that are responsible for bringing about lot of infections in them. So now let us understand some of the infections and how we can prevent them in the healthcare settings especially. So the infections in any of the healthcare sector, this is referred to as the healthcare associated infections. We term that as HAIs. And it is an infection that is acquired by a patient during the care delivery in a hospital or other healthcare facility that was not present or incubating on admission. And this is a definition that is given by the World Health Organization. So this is mostly caused by the microorganisms which are resistant to one or more of the commonly used antibiotics. Okay, so now here in this case we find certain the tuberculosis bacilli or certain other bacteria which are resistant to many of the antibiotics, and then we find that these organisms are actually thriving in such environments. The common healthcare associated infections, they include those of the urine, then the urinary tract infections especially, then the chest infections, the blood and also the wound infections. Now the visitors, the family members and the healthcare workers all can be affected by these healthcare associated infections. Then these normally manifest after 48 hours of the hospital contact, and the source of the infection, that is due to the cross infection, that is from the person to person contact, from the staff and also even from the bed linen and from the germs, even due to the unhealthy and unhygienic conditions which are prevailing in the healthcare settings. Inappropriate use of the invasive devices and the antibiotic, this can also be one factor. The high risk diagnostic or therapeutic procedures, there can be the water stagnation, the environmental factors and conditions, a poor water, sanitation, waste management and cleaning practices that are being followed in the washrooms and other laundry facilities. Then understaffing can be one reason, and also overcrowding and the population in the setting can also be another problem. Poor knowledge of all the measures including the injection and blood transfusion safety, then absence of the local national guidelines and policies of the programs, and the lack of the surveillance and research. These are some of the factors which can be responsible. Now millions of patients, if you see, they are affected by the healthcare associated infections globally every year, and that is leading to significant mortality and financial loss for the healthcare systems. So while the urinary tract infection, that is the most frequent healthcare associated infection, especially in the high income countries, but we find that the surgical site operation, this is actually more so it is found in the Asian and in the developing countries, and it is 9 times higher than what is observed in the developed countries. So this is the cause of concern in the developing and in the low and the middle income countries. The burden of these healthcare associated infection in the patients and in the healthcare workers. So at any given time, the prevalence of the healthcare associated infection in the developed countries, that varies between 3.5 and 12%, and the prevalence of this, it varies between 5.7 and 19.1 in the low and the middle income countries. So as per the Hospital Infection Society of India, the incidence of this in India, it is ranging from 5% to the 30%. Let us now see some key facts about the healthcare associated infections and their other aspects. So this healthcare associated infection frequency, on an average we are finding that 1 in every 10 patient, he is affected by the HAI globally. And the hand hygiene practices, on an average 61% of the health workers, they do not adhere to the standard recommended hand hygiene practices and washing. Then the injection safety, this is also another big problem. So 16 billion injections are administered every year worldwide, up to 70% of which are given with the reused syringes and the needles in some of the developing countries. Then the AMR, that is antimicrobial resistance. So the patients with the methicillin resistant Staphylococcus aureus, this is given in short form as MRSA. They are about 50% more likely to die than those infected with the non-resistant strains. Then in the intensive care units, in high income countries, up to 30% of the patients, they are affected by at least one of the healthcare associated infection in the intensive care unit, and in the developing country also the frequency is at least 2 to 3 times more higher. Neonatal care, that is in the pediatric divisions and in the newborn children. Among the hospital born babies, infections are responsible for 4% to 56% of all causes of death in the neonatal period. Maternal care, now especially if we talk about Africa, up to 20% of the women, they get wound infection after a cesarean operation and procedure, and that is affecting their health and ability to care for their baby after birth. So let us research to explore more of these kind of the infection and the resistant infections and emerging infections which are of concern. Mode of transmission. Now in the context of the healthcare sector, there are 3 modes of transmission that can occur. For example, blood-borne infection, other infectious diseases, and fecal-oral route transmission can also occur. Now in the other infectious diseases, we can have the contact infections and also the airborne infections and the transport. Blood-borne pathogens. So we have discussed about this in the occupational health and safety course, but in this the healthcare workers, they are exposed to a lot of the blood-borne pathogens because they are working with blood and the body fluids. So in the course of their work when attending to the patients. So given their working conditions, they are at high risk of developing the blood-borne viruses, including the AIDS virus, then the hepatitis B and the hepatitis C viruses. So the risk of infections for the healthcare worker, that depends on the prevalence of the disease in the patient population, the nature and the frequency of the exposure to these diseases. Occupational exposure to blood can result from the percutaneous injury, that is needle stick and sharp injuries, then the mucocutaneous injury, that is splash of blood or the bodily fluid into their eyes, into the nose and also into their mouth, or the blood contact with the non-intact skin. Most of the common form of the occupational exposure to the blood and the likely which that can result in infection is the needle stick injury diseases. And this most commonly they are due to the two-handed capping, because they use both their hands for capping the vials, and unsafe collection and disposal also of the sharp waste. So that is why safe biomedical waste disposal practices should be followed in the sectors. Now most of the blood exposure in the health setting, they can be preventable. How? The strategies to prevent the health workers, including implementation of the universal precautions. As I told you, they are the frontline workers, so they need to be immunized and vaccinated on priority, first based, and against the hepatitis B viruses and even the emerging infections like the coronavirus. Then there should be provision for giving them the personal protective equipments, and also management of these exposures has to be done properly. Successful implementation of these strategies, that requires an effective infection control committee with support from the health administration. Other infectious diseases. So in addition to the bloodborne pathogen, healthcare workers are also at the risk of other occupationally acquired infectious diseases. So depending on the specific pathogen, the transmission can occur via direct contact from the patient, that is through even contaminated surfaces, through the exposure to the bioaerosols, which is present in the person's or the patient's room, even from the blood, linen from their clothes that they are wearing, and also it can be generated by coughing and sneezing, because all this can release the droplet infections and aerosols into the atmosphere. So the potential threat which is associated with a new and emerging infectious disease, that have caused a lot of concern in the recent years. These threats, they involve the SARS, that is a severe acute respiratory syndrome due to the coronavirus, then the Asian influenza, pandemic influenza, the multi-drug resistant pathogens such as methicillin resistant Staphylococcus aureus and the drug resistant tuberculosis which we are seeing. So, in most of the cases, simple interventions can prevent the transmission. Hand washing, vaccination and rapid recognition and appropriate isolation of the potentially contagious patients, these are specially important interventions. Comparison of the three major contact or airborne infections. So, this MRSA, which is an acronym for the methicillin resistant Staphylococcus aureus, an antibiotic resistant strain of the staphylococcal bacteria which is found in most of the healthcare facilities and now it is spreading in the community. So, basically due to overuse of the antibiotics in the hospitals, that due to continued lapses in the infection control. So, this has spread globally in some countries, and those countries which are having the highest rates, they include the United States, in Canada, in Japan and also in Indonesia. And this is spread by contact by the healthcare workers who do not wash their hands frequently, and also they are spreading through the contaminated surfaces and the equipment. So, how do we prevent such infections? Insist that all the healthcare workers wash their hands before wearing their gloves or their equipments, and disinfect your room with the wipes, frequently touched surfaces and also the prudent use of antibiotics. The severe acute respiratory syndrome. So, this is a virus respiratory illness and it is caused due to the coronavirus group of the viruses, and it is called the SARS associated coronavirus. So, it is also referred to as SARS-CoV, and it was first reported in Asia in February 2003, and after that we have had several strains of this virus which are coming up in the society. So, this is transmitted most readily by the respiratory droplets which is produced when an infected person coughs or sneezes. And how do we prevent the infection? By wearing the personal protective equipment gowns, the N5 respirator or the mask which is mandatory to be used, and gown and the gloves should also be used mandatorily. Now, some people developed hypersensitivity by using the rubber gloves and the latex. So, this hypersensitivity, this was first reported in Germany in the year 1927, and since then there have been a lot of increase in the number of reported cases, and due to this immediate hypersensitivity type due to the lattice products. So, the clinical manifestation of this allergic reaction, they are similar to the symptoms that are experienced by anyone who is allergic to food, to drug and to dander, to the animal dander and also to the pollen grain. For example, those the Parthenium pollen. So, this Parthenium, when anybody goes even near that, so people get some kind of an eczema and the allergic and irritation of their skin, and skin dermatitis can occur. So, in the same way, clinical manifestations can occur as allergic reactions due to the wearing of these gloves for a long period of time. And then they can also include urticaria, asthma, rhinitis, conjunctivitis and even anaphylactic reactions. The cause of this is attributed to some residual water soluble proteins which are found in the latex products, and this occurs in the well defined risk groups that can include the healthcare workers in the rubber industry, patients with the spina bifida and so on. Now, the general principles of the prevention of the biohazards. This also we have discussed before in the by using the biosafety cabinets, but here engineering controls are very important. They need to be designed, and the dedicated negative pressure isolation rooms are required. So, these rooms are for those patients who require the airborne droplet nuclei isolation. That includes those who are carrying or who are carriers of the pathogens such as measles, the varicella zoster like the herpes, the chickenpox, then the legionella, tuberculosis and so on. Then the purpose of placing the patients in the negative pressure rooms is to reduce the risk of the infection via the airborne transmission to the other patients. Negative pressure rooms area, this is also known as the airborne infection isolation room or the infectious isolation facilities. A dedicated exhaust system is also to be provided to the negative pressure isolation room, and to maintain this negative pressure of the exhaust system, that should remove a quantity of the air greater than that of the supply air. High efficiency particulate air filtration system, it is also called as HEPA, HEPA. So, these HEPA filters are generally effective and removing 0.3 micron meter sized particles, and this has an efficiency of almost 99.97%. and they are even more effective at removing the smaller as well as the larger particles. So for minimizing the airborne particles, the air must be circulated into the room with a velocity of at least 0.25 meters per second through high efficiency particulate air filter, which excludes the particulate matter of defined size, and if the particulates are 0.3 micron in diameter and larger are removed, the air entering the room will be essentially clean and free from the bacterial contaminants. The containment of the biohazard. So biocontainment, this is normally referred to as the laboratory safety and biosafety, and it pertains to the microbiological practices and the lab based procedures where the physical containment of the pathogenic organisms is done. That is, the bacteria, the viruses or the toxins, they may be pathogenic and they are usually by isolation in the environmentally and biologically secure cabinets or rooms, so that the accidentally this is not being infected to the workers and it is not released into the surrounding community. The primary containment is the first container in a direct contact with the biohazard as well as the materials for protection of the personal and immediate laboratory environment from exposure to the infectious agents. Primary containment will require the proper storage containers, good microbiological technique and the use of appropriate safety equipment such as biological safety cabinets. Secondary containment, that involves the protection of the environment external to the laboratory from the exposure to the infectious materials, and that is provided by a combination of facility design and operational practices. So the biosafety cabinet, this is an enclosed ventilated laboratory workspace for safely working with materials that are contaminated or it can be potentially contaminated with pathogens requiring a defined biosafety level. Now this purpose of this biosafety cabinet is to serve as a means to protect the lab worker and the surrounding environment from the pathogens. Ultraviolet germicidal irradiation system. This we also refer to as UVGI systems. So this is also a disinfection system which uses the short wavelength ultraviolet light in order to kill or inactivate the microorganisms by destroying their nucleic acids and disrupting their DNA, and then they are unable to perform their vital cellular function because it has been disrupted. So this is used in a variety of applications such as the food, air and also in the water purification systems. Then finally the administration control. So these administrative controls also are required and they should be in place in order to effectively prevent the occurrence of infections in a healthcare setting. So the record keeping has a vital role in the control, and the hospital pharmacist, he should maintain the record of the potency of the drugs, incompatibility, conditions of storage, deterioration, that is a worn out or the expired drugs, and the records of the antibiotics that have been distributed to the medical department and so on. Central sterilization service also should be maintained. That should maintain the records of the autoclave run, so that in the long term the availability of the record should be available and maintained. Then the maintenance department should have the inspection details of the plumbing, the heating, the refrigeration equipment, the radiology equipments, the electrical fittings, the air conditioning, etc. Then apart from all this, the information technologies like the electronic medical record of the patients, the hospital information system, computerized physician order entry and the clinical decision supports, all these support facilitates the delivery of the antibiotic stewardship programs. Medical surveillance of the high risk workers. So the hospital acquired infections or the nosocomial infection rates in the patients among the healthcare workers at a facility, this is an indicator of the quality and the safety of the care being rendered. So the development of a surveillance process is to monitor this rate, and it is an essential step in order to identify the local problems and priorities and evaluate the effectiveness of infection control and activity. The surveillance is an effective process to decrease the frequency of the hospital acquired infections. Isolation and restricted entry. So this you would have seen even in the ICU. That there has to be a strict isolation procedure where the patients should be kept isolated, and only restricted entry from the visitors or even their family members should be given, and even in that case only one member will be entertained. So this will reduce the chances of the spread of infection from the patients to the others. Awareness campaign may be organized from time to time to make the patients and visitors aware about the infectious diseases and the preventative measures that have to be taken on their part. The specific measures which can be done for the healthcare associated infections, that will be the injection safety. This should be done for the healthcare safety workers. So, the unsafe injections that can lead to the transmission of variety of pathogens, including the viruses, then the bacteria, the fungi, the parasites, and then they can cause adverse events like the abscesses and the toxic reactions. Reuse of syringes and needles, that is also common in many of the settings. Now, you would have seen that in many cases that the needles are being reused, and also the patients are being exposed to the pathogens directly or indirectly via the contaminated equipments, and also through the contaminated medical wires. Injection in a hospital waste. So, the syringes should be either mutilated or the needle should be cut and stored in the tamper proof and leak proof, puncture proof containers for the sharp storage, and the safety of the community should be taken into consideration. So, the injection material should be disposed according to the local and international health standards and environmental standards, so that the waste does not produce any hazard to the people in the community. Then the personal protective equipment, this is providing a physical barrier between the harmful organisms and the healthcare personnel. So, it is preventing the cross transmission of the microorganism, and it includes the glove, the protective eyewear, the mask, the apron, the gown, the cap, the hair cover, the boots, the shoe cover, everything. So, all the parts need to be protected well, so that the harmful pathogen is not entering the body of another individual or even the air, for instance. So, the standard precautions to be followed include hand washing after any direct contact with a patient, safe collection and disposal of the needles and sharp with puncture proof and liquid proof boxes in each patient area, wearing of the gloves, wearing mask, eye protection and a gown. Standard protections or the precautions which to be followed are covering all the cuts and abrasion with waterproof dressing, promptly and carefully cleaning up the spill of blood and other body fluids, using the safe system for hospital waste management and disposal. So, with this, I hope you have had a good understanding of this session on the prevention of the hospital and the healthcare associated infections that can be acquired by the healthcare workers in the healthcare settings. Thank you for your patient listening.